Hi friends, today I have come with yet another interesting topic, high blood pressure, otherwise called hypertension. I am Dr. Gopal s.Pillai. I am head of ophthalmology at Amrita Hospital, Kochi. I am doing these videos so that this knowledge can be percolated across you people. So please subscribe and press the bell icon as well as spread this awareness message to your friends and dear. Blood pressure measurement is something that every medical student, allied health student, nursing student will study in their first year of their medical life. It is a very, very important measure of overall health. Imagine a pipe system that you've laid in your house, and in about however good you have laid, in about 25 years, 30 years, there will be some leakages somewhere in some bathrooms. There may be some block here and there which you would like to rectify. And this rectification process is very important. If you do not do that, the entire system will collapse over a period of time. Just imagine the blood vessels that sprout from the heart and goes across the body to each and every millimeter of the body. These are the blood vessels which supply oxygen to each and every cells in the human body. Imagine when a person lives for about 60 or 70 years, how much these blood pressure changes can affect the blood vessels. Just like that, because of aging, blood vessels have a lot of changes. It will become rigid and its plasticity or elasticity reduces significantly. Add hypertension to it. You must have seen people watering the plants, and when two hose pipes are joined together, there may be a small leak. And if you increase the pressure in the pipe system, what will happen is that this small leak will become a big sprout. Similarly, if there is any problem in our vascular system, in our vessels, and if the blood pressure also increases, what will happen? You will have bleeding or some block here and there in some part of the vascular tree or the other. Major problem, right? So, to prevent these, we need to know two things. One, how much is your baseline blood pressure? Number two, how much the blood pressures have affected the blood vessels itself. For number one, you can check the blood pressure. But there is a problem here. If you do some exercise, the blood pressure may go up. If you eat a sumptuous lunch, maybe with a lot of salt, and your blood pressure may go up. You're watching a movie and there's a suspenseful fight going on there. Or you're watching a cricket match with intense last moments of 4 balls and 3 runs remaining. These all will increase your blood pressure. So daily your blood pressure will vary a lot. And so at any point of time, checking the blood pressure may be a little fallacious. However, monitoring of blood pressure is quite important. The second thing is about how much the blood pressure or the hypertension has affected the vessels. That is a very important. There's only one place in the whole human body where you can actually see the blood vessel. It is inside the retina. So a dilated retinal examination, you have to put drops into your eyes to dilate the pupil, and then you do a dilated retinal examination. We will be able to actually pick up the changes in the blood vessel because of long-term hypertension. Hypertensive retinopathy is what we call that. And hypertensive retinopathy goes from grade 1 to grade 2 to 3 to 4. Grade 1 is about a little spasms of the blood vessels in the retina, some small areas of thinning of the blood vessels. Grade 2, whenever one vessel crosses over the other, there may be some compression there and there may be some changes there. Grade 3 means there are some changes in the retina like soft exudates and small hemorrhages, etc. And grade 4 is when the optic nerve, the nerve which connects the eye and the brain, actually gets swollen up. Grade 4 hypertension is actually a medical emergency and the patient requires urgent, immediate intervention. They require admission to reduce the blood pressure. If you look at something called hypertension, it's very, very common in the community. About 30 to 40% of patients will have hypertension. And we did a study of about 5,000 odd patients with retinal problems based on a Department of Biotechnology grant, and we found that 60% of patients were actually hypertensives. So hypertension will cause a lot of these vascular problems. What is the normal blood pressure? It is about 120/80. When the blood pressure rises, then it is basically hypertension. Hypertension can be primary or essential when no specific cause is there. And we also can see that if there is a heart problem or a vascular problem itself or even a kidney problem, the blood pressure may rise. This type of hypertension is called a secondary hypertension. And there is sometimes, instead of 120/80, the blood pressure may rise up to about 240, 140. That is called a malignant hypertension. Again, malignant hypertension is an emergency which requires urgent admission and control of blood pressure. How can hypertension involve the human body? Right from heart attack to stroke to kidney issues to a lot of problems across the body, hypertension is a major villain. The eye is no exception. We know that inside the eye there could be vessel block, either an arterial block or a venous block, or even the blood circulation to the optic nerve can be cut off suddenly in a case of hypertension, and they will cause sudden loss of vision. What is the problem in treating hypertension? The major problem in treating hypertension is completely asymptomatic. The people do not have any symptom of high blood pressure. Very rarely some people may complain of some headache, or maybe some people may feel a little ill, etc. But otherwise, hypertension do not have any symptoms. That is a major problem and challenge. And so, my friends, you should check your blood pressure and also look at how much these blood pressure changes has affected the blood vessels. Visit an ophthalmologist, get the check done, and find out whether the hypertension has affected the blood vessels. If it has indeed affected the blood vessels, you need to be quite aggressive about managing the hypertension. We need to add tablets and keep your blood pressure quite low. Add to it your dietary changes. Probably you have to reduce your salt intake by reducing achar or papad or all those fried stuff, and also reduce the fatty food. But that alone will not conquer the hypertension. We need to treat it with medicines to bring the blood pressure down as close to 120/80 as possible, and then you will be living a long, healthy life without heart attack and stroke. Thank you.